I am Shannon Weber with Hive, a hub of positive sexual and reproductive health. It's April 2015. We're here in Oakland at the Trans Summit. And you want to introduce yourself?
I'm Prue Mendiola. I am a senior lead HIV test counselor with Friends Research Institute in Los Angeles. And I've been doing this work for about 5 years now.
And we actually first met in November at the first California statewide PrEP think tank.
Yes.
Which was awesome, that all these people across California were thinking about what would it look like for PrEP to roll out across the state. And so I want to talk with you a little bit about PrEP in your life and in your work. When did you first learn about PrEP? Do you know?
Well, I mean, in my mind, it's more an issue of who did I learn it from versus when. I've been doing this work for a while, but I've been working with the Transgender Service Providers Network in Los Angeles, and as a transgender woman, this work is like really important to me, and so I've been doing that, and I was the chair of the TSPN for about 2 years. So through the work that I do, Dr. Raphael Landovitz actually approached me and said, would you be willing to participate in a community advisory board? We're starting these research projects in Los Angeles. And we would really like to have a transgender woman in a leadership role sort of representing on our community advisory board. I adore Dr. Landovitz.
Yes.
Anyway, so we started rolling that out, and that's when I started learning about it. And I was actually surprised doing the work that we do, not having heard about it before.
Right.
So, so I learned all the ins and outs, and then from that, not just the community advisory board, but through the research projects and things like that, we began planning forums to educate the transgender community on PEP and PrEP, and just sort of spreading awareness of it and helping people access it.
Oh, I love that you put the PEP and the PrEP together. It's so important because I think sometimes people forget, we already have had this option for a long time. We haven't accessed it or offered it in the way that we could, but it is it goes together. And then when did you think PrEP applied to you, or that it might be useful in your own life?
Well, I was married for 2.5 years, and in a monogamous relationship, and so prevention kind of just fell towards the back of my mind when you think of monogamy as prevention, and getting tested with your partner and things like that. Well, that relationship ended not entirely well, but for the best. And this was last October. So I got divorced from my husband, and for a while I was just enjoying being by myself, just completely, not solitary, because I live with my best friend, and I have an amazing support system, but
it was like your transition time to me.
Right. So anyways, a couple of my coworkers pushed me to start dating again, and created an online profile for me, and I was resistant to the idea of dating. I didn't feel like it was time. It was so soon for me. But they pushed me towards it, and I kind of agreed, and so I started to begin thinking about, prevention when you think about having sex, well, I guess a lot of people don't think about STDs and things like that, particularly in cisgendered, heterosexual communities. They think a lot less about that and more about pregnancy and such things. But when you are an HIV prevention counselor, it's in your mind, you know? So I thought about maybe starting PEP and PrEP, and one of the things that people don't realize is that as human beings, we're bad at planning when we're going to have sex. A lot of the times it just happens, and how it happens is not, even when you have the best of intentions, is not always the way you intended it. Particularly when you enjoy wine the way I do. But anyway, so I thought of going on PrEP as one of my methods of prevention. So I sent an email to my doctor. I'm with Kaiser. I have the best doctor in the world. Dr. April Soto is amazing. She's
Love
a
that.
wonderful woman, such a transgender advocate, and does amazing work. Anyway, so I sent her an email. I said, can you give me a call whenever you get a chance? I'd like to talk to you about something. And so I'm in my car, of course, hands-free device.
Thank
I don't
you,
condone
thank you.
driving and texting. And,
Safe in bed, safe in the car.
Yes.
I like that about you.
Yes. So I'm in my car. I'm driving. I was going to the Beverly Center. I forget why. And she called me, and she's like, what's going on, Miss Prudence? And I said, hey, Dr. Soto, what do you think of me going on PrEP? She's like, PrEP? She's like, okay, so Truvada for prevention. And I said, yeah. She's like, okay, we can do that. She's like, let's set an appointment. We'll chat a little bit more about it, and we'll start that. And so the initial steps were relatively simple. But because of sort of standards and things right now with how PrEP is provided, even when you're insured, they do make you jump through a lot of hoops. You have to run tests. You have to go meet with people. You have to. There's a waiting period, which I think a lot of the times is a problem because we're showing that when people are seeking PrEP is when they're most at risk.
Right.
And there was a time where, I was having sex. I was, dating, and I didn't have access to it. And
this was because you were getting your labs done?
Because of that, and, I work 11 to 7:30 most days out of the week.
Yeah.
And it's hard to get appointments on the weekends or during the times that I can go there. So that was one of the biggest obstacles. But you have to go several times. You have to see your doctor, get a referral, go to the PrEP provider, have a meeting with them, discuss it, run labs, and the labs take a week to come back. So there's a whole process. Yeah. So, anyways, eventually it got to the point where, okay, here's your prescription and whatever, and then it was dealing with the pharmacy. I was specifically at an infectious disease clinic at Kaiser, went down to pick up my prescription for Truvada, and they did not have it available. So in my mind, I'm like, this is an infectious disease clinic, and you're telling me you don't have Truvada. So that was a little bit bizarre to me. And then dealing with co-pays, when you work in a community-based organization, finances are not always the most ideal.
Right.
So at the time, I have what's called medical financial assistance through Kaiser, which covers most of my co-pays. At the time, it had expired. You have to renew it every 6 months. And so when I did go, then I had a co-pay, and I was like, well, let me just see how much it is. Maybe I'll cover it. And it was like $60 or something like that.
Wow, yeah.
And at the time, the next day was payday. That day wasn't. And I had $40 in my bank account. So I said, you know what? I'll have to come back for this.
Yep.
Well, then went through that process, got refunded, had to get my approval letter another 3 weeks later.
Oh, wow.
I'm coming back, and I'm trying to get it. They didn't have it available. You have to pre-order it. You have to pick it up. So it became this whole process. After I finally got my prescription, started taking it, now it's a more simple process. I just have to go every 3 months. I have to get tested once a month, and but now I can have the prescription delivered to me.
So for you, it was this initial on-ramp, but I'm hearing, like, both as a message to someone who might want to get PrEP, to stay with it, but also as we think about access and implementation, that we need to streamline and educate people about what those steps are, and see what we can do to do away with some of that.
Right. And there's a lot of people working towards making access easier. Unfortunately, we're finding right now with the way healthcare is people sort of in the middle are having a harder time accessing.
Right.
We discussed that at the think tank.
Yep.
Is that if you're in a certain tier, you have this tremendous copay. If you're on like Medi-Cal or Medicaid, it's more the obstacle is more about getting a provider that will prescribe it, but it will be covered. Or if you're in the higher tiers or you're really well insured, such as I am, the cost is virtually nothing. But people sort of in the middle
Yep.
are having a lot of trouble.
Yep. And in states where we haven't expanded Medicaid. But anyways, that's a whole nother video.
Whole nother story.
Okay, so have you shared your Truvada use with other people? Have you experienced support or stigma? Either one around using Truvada.
It's interesting because in the beginning, I was talking to a couple of my colleagues and coworkers that are pretty well educated and well versed in certain things. And I said, I think I want to start. Originally, it was a joke because, I'm married and prevention is not that much of a thought. And I said it because just as a provider, I'm like, maybe I should just get on PrEP so that I can see what it's like so that I can then share my knowledge. So it was kind of a little joke. And then I thought, maybe that shouldn't be a joke. Maybe I should. Well, then I started discussing it with sort of my colleagues or my coworkers and peers. And I literally got responses like, well, why? Are you just not going to use condoms anymore? And so those were some of the responses that I got like that. And honestly, I feel like whatever goes on in my bedroom is my business and I don't have to share that. But that wasn't so you do get this stigma, and it's a new tool and it's incredibly effective. A lot of the research is showing that with participants that are actively on their PrEP and they're measuring it in their system through these studies, even in serodiscordant couples and things like that, no people are getting infected.
They take their drugs.
Right, when they're taking them right. I believe one person was infected in Dr. Landovitz's study, and that's because that person wasn't taking their meds.
That's kind of what we've seen in all of the studies. People who take the drug at work, kind of like all other drugs, they work when you take it.
Right.
So you have an incredible amount of knowledge and access, and I'm wondering from your perspective, because I think that's a gift, what do you think are the next steps for us as we think about rolling out or this continued implementation of PrEP for trans and non-trans women?
I think that educating the community is definitely really important. There are people that still don't know what PEP and PrEP is. As much as we try and have these forums and educate our participants, there are people that are not accessing community services. There are people that are not involved in the community. And so it's really reaching those populations. And I think, again, trans or non-trans, it's an amazing prevention option for anyone who feels that they might be at risk. And I feel like it should be incredibly accessible, just like birth control, That's really very similar in that sense. And that's part of it. Also educating providers and, doctors that have the capacity to provide this, but maybe don't even know what it is. So those are a couple of the next steps that I think, and definitely with Truvada now, the FDA might be passing the ability to make it generic too. So that'll be as far as cost-wise, that should help somewhat. So that's another thing, and just making it more accessible, I think.
I want to thank you for making this video. I wanted to make I fell in love with you when we met, of course, but then I really wanted to make a video showing this empowered trans woman's story around having a female-controlled prevention method and what is that like. And I think that you're right about the education. I think this video will go a long way, and I honor you for being brave and sharing your story about leaving your relationship and making these choices and doing it out loud so that we all can learn from it.
Thank you, Shannon.